Hello, welcome. I'm Janu Goel, and in this section, I will review some commonly used injection techniques of wrist and hand under sonographic guide. Carpal tunnel injection is a commonly performed injection procedure of hand and wrist. There are many different approaches for injection of carpal tunnel. Commonly used approaches are from medial to lateral and from lateral to medial in plane approaches, and then there are some out of plane approaches, but I prefer a lateral to medial in plane approach. Carpal tunnel is formed by carpal bones and flexor retinaculum attached to the tubercles of scaphoid and trapezium laterally and to the pisiform bone and hook of hamate medially. The proximal limit of the carpal tunnel corresponds to the distal crease on the anterior aspect of the wrist. The median nerve, the flexor tendons of the digits, and the flexor pollicis longus tendon pass through the carpal tunnel. Carpal tunnel syndrome is caused by compression of the median nerve due to increased pressure in the carpal tunnel. For the carpal tunnel injection, patient is placed supine with the arm on the side. The wrist is supinated and placed on a small pillow, and the target site for injection is defined and the point of needle entry is marked. I insert my needle through a space between the flexor carparadius tendon and the median nerve, and here on the sonographic image, here your FCR tendon and the median nerve, and direct it in a space between the median nerve and the flexor carparadius tendon. Here is your space, and here in this image, here your median nerve, here your FCR tendon, here your needle going over the FCR tendon between the space between the median nerve and the flexor pollicis longus tendon. Wrist has three main synovial joint cavities: the distal radioulnar joint, the radiocarpal joint, here is your radiocarpal joint, the midcarpal joint, here is your midcarpal joints. Normally, these three joints do not communicate with each other, and apart from these three separate joint cavities, wrist has two other separate joint cavities. One is between the pisiform and triquetrum, the piso-triquetral joint, and the first CMC joint, the joint between the first metacarpal and trapezium, also called trapezio-metacarpal joints, and these joints are also a frequent cause of wrist joint pain. Based on the presenting symptoms and individual preferences, there are many different approaches to the wrist joint injection. Position of the wrist depends upon the target site and the planned approach. Here is an example of a radiocarpal joint. Herein, the patient is placed supine with the wrist pronated and placed on a small pillow, and the needle is directed in the radiocarpal joint from distal to proximal. Here is a radiocarpal joint, and here is the needle getting into the radiocarpal joint directed from distal to proximal. Here is the position of the patient and the technique of direction of the needle under the transducer. The first CMC joint is a common cause of wrist pain. Injecting at the dorsal aspect of the first CMC through the anatomical snuff box is risky due to the crossing of the radial artery through that space. The imaging through the volar aspect is difficult due to the presence of the thinner muscles, and the joint looks very deep. Placing the transducer at the radial border of the first metacarpal bone and at the lower end of the radius of the volar aspect provides an excellent view of the first CMC joint for injection. For the injection of the first CMC joint, I use an in-plane technique of injection. I either approach the joint from proximal to distal. Here is your needle being directed from proximal to distal, and here is your first CMC joint being injected from proximal to distal approach, or I use a distal to proximal approach. Here is the needle coming from distal to proximal. Here is the first CMC joint and the injection being done from distal to proximal approach. DeQuervain tenosynovitis is caused by the thickening of the extensor retinaculum on the first extensor compartment. An accessory septum may separate tendons of the adductor pollicis longus and extensor pollicis brevis in two separate compartments, and the inflammatory process may involve only one of the compartments, and the sonography helps to direct the needle in the compartment involved in the pathological process. The needle can be inserted along the long or the short axis of the tendons. For the injection of the first extensor compartment, the patient may be sitting or supine with the wrist placed in an ulnar decubitus position. The needle can be inserted either along the long axis or along the short axis of the tendons. Here I've shown an in-plane needle insertion in the first extensor compartment along the long axis of the tendon from distal to proximal. Here is the thickened extensor retinaculum, and here is the tendon. Here is your needle deep to the thickened extensor retinaculum and into the first extensor compartment. Tendon sheath of the flexor tendon is injected either along its long axis or along its short axis. I usually prefer in-plane approach along the long axis of the tendon with the needle directed from distal to proximal. The needle is inserted in the tendon sheath just deep to the A1 pulley, and a small of the test injection is helpful to confirm the position of the needle before injecting the entire volume. Here you see the flexor tendon, and here is your A1 pulley, and the needle being inserted just deep to the A1 pulley, and the injection volume will be seen spreading all across the tendon and confirming that the accurate injection has been done. With the palpation guided method, the needle is inserted within two bones forming the joint. Synovial recess of the joint is superficial to the joint line and is reflected proximal to the metacarpal head. The extensor tendon is located on the dorsal surface of the joint, whereas the vessels and nerves course along the lateral and the medial side of the digit. I direct my needle in the joint recess on the sides of the extensor tendon, either from proximal to distal or from distal to proximal.